Hello and welcome everyone. Myself Mizanur Rahman, and today my topic of discussion is pleural effusion, then pulmonary tuberculosis and emphysema. So let us start. First of all, what is pleural effusion? Pleural effusion is the accumulation of large amount of fluid in the pleural cavity. So what is the pleural cavity? Present between the two pleural space. Okay. And pleural effusion is the accumulation of large amount of fluid in the pleural cavity. Now, what are the causes? Causes are blockage of lymphatic drainage, excessive transudation of fluid from pulmonary capillaries due to increased pulmonary capillary pressure caused by left ventricular failure. Then the inflammation of pleural membrane, which damages the capillary membrane and allowing the leakage of fluid and plasma proteins into the pleural cavity. Now, what are the features? Pleural effusion causes atelectasis, leading to dyspnea and other respiratory disturbances. Now, what is pulmonary tuberculosis? Pulmonary tuberculosis, or TB, is a disease caused by tubercle bacilli, and this disease can affect any organ in the body. However, the lungs are affected more commonly. Infected tissue is invaded by macrophages and later it becomes fibrous, and affected tissue is called tuberculosis. What is TB or tuberculosis? Tuberculosis is a disease caused by tubercle bacilli, and this disease can affect any organ in the body, and however the lungs are affected more commonly, but infected tissue is invaded by macrophages and later it becomes fibrous, and the affected tissue is called tubercle. Now, what are the features of pulmonary tuberculosis? Initially, the alveoli in the affected part become non-functioning due to thickness of respiratory membrane, and if a large part of lungs is involved, their diffusing capacity is very much reduced, and in severe condition, the disturbances of the lung tissue is followed by formation of large abscesses cavities. So, what are the features? The initially alveoli in the affected part become non-functioning due to thickness of respiratory membrane, and if a large part of the lungs is involved, the diffusing capacity is very much reduced, and in severe condition the destruction of the lung tissue is followed by the formation of large abscess cavities. Now the emphysema. What is emphysema? Emphysema is one of the obstructive respiratory disease in which lung tissue are extensively damaged, and the damage of lung tissue results in the loss of alveolar walls. Because of this, the elastic recoil of the lungs is also lost. So, what is emphysema? Emphysema is one of the obstructive respiratory disease, and in which the lung tissues are extensively damaged, and the damage of lung tissue results in the loss of alveolar walls, and because of this, the elastic recoil of lungs is also lost. Now, what are the causation of emphysema? Emphysema is caused by cigarette smoking. Number 2 is exposure to oxidant gases. Number 3 is untreated bronchitis. So, what are the causes? One is cigarette smoking, one is exposure to oxidant gases, and number 3 is untreated bronchitis. Now we will know about the development of emphysema. How the development of emphysema occurs. First of all, when the smoke or oxygen gases irritate the bronchi and the bronchioles, leading to chronic infection. So first of all, the chronic infection caused by smoke or oxygen gases which irritate the bronchi and bronchioles and which leads to chronic infection. Then it increases the mucus secretion from the respiratory epithelial cell, causing obstruction of air passage. And number 3 is cilia of the respiratory epithelial cells are partially paralyzed and the movement is very much reduced, and because of this the mucus cannot be removed from the respiratory passage. So what happens then? Then the destruction of alveolar mucous membrane occurs, and when the destruction of alveolar mucous membrane occurs, after all that the destruction of elastic tissue occurs. Normally there is loss of some elastic tissue because of the proteolytic enzyme called elastase, but that is very much negligible. Moreover, the liver produces the elastase inhibitor, especially alpha 1 antitrypsin, and which prevents the destruction of elastic tissues, but due to heavy smoking or because of constant exposure to oxygen gases, the pulmonary alveolar macrophages increase in number, and macrophages release a chemical substances which attracts a large number of leukocytes, And the leukocytes release the protease including elastase, which destroy the elastic tissue of the lungs. Now we will start knowing what are the effects of emphysema. So let us start. First one is airway resistance increases several times due to the bronchial obstruction. So the movement of air through the respiratory passage becomes very difficult and it is more pronounced during expiration. And the number two effect is due to destruction of alveolar membrane and elastic tissues, the lungs becomes loosey and puffy, and so the diffusing capacity reduces to a greater extent, and however lung compliance increases and the aeration of blood is impaired. Enough oxygen cannot diffuse into the blood and carbon dioxide cannot diffuse out. Number three effect is obstruction also affects the ventilation perfusion ratio and resulting in poor aeration of blood. Number four is due to destruction of lung tissues and the number of pulmonary capillaries also decreases, and it increases the pulmonary vascular resistance and which leading to pulmonary hypertension. And number five, that is over the years chronic emphysema could lead to hypoxia and hypercapnia, and it will finally cause the prolonged and severe air hunger, that is dyspnea, which leads to death. So this is our today's topic. If we summarize, first of all we have discussed about the pulmonary effusion. Pulmonary effusion is nothing but the accumulation of large amount of fluid in the pleural cavity, and the causes of this pulmonary effusion are blockage of lymphatic drainage, excessive transduction of fluid from pulmonary capillaries due to increased pulmonary capillary pressure caused by the left ventricular failure. Then number three is inflammation of pleural membrane, which damages the capillary membrane and which allows the leakage of fluid and the plasma proteins into the pleural cavity. And now the features: pulmonary effusion causes atelectasis, which leads to dyspnea and other respiratory disturbances. Now, we have discussed about the pulmonary tuberculosis. What is TB or tuberculosis? It is a disease caused by tubercle bacilli, and this disease can affect any organ in the body. However, the lungs are affected more commonly. An infected tissue is invaded by macrophages and later it becomes fibrous, and affected tissue is called tubercle. Your examiner may ask you a tricky question, that is, TB does not affect which organ? TB does not affect the hair and the nails only. Except these two parts, any part of the body can be affected by TB or tuberculosis. Okay. Now the features. The initial alveoli is affected part become non-functioning due to thickness of respiratory membrane, and if a large part of the lungs is involved, the diffusing capacity is very much reduced, and in severe condition the destruction of the lung tissue is followed by the formation of large abscessed cavities. Now the last topic is emphysema. What is emphysema? Emphysema is one of the obstructive respiratory disease in which the lung tissues are extensively damaged, and the damage of the lung tissue results in loss of alveolar walls, and because of this the elastic recoil of lungs is also lost. And emphysema is caused by cigarette smoking, exposure to oxidant gases, and untreated bronchitis. Now we have discussed the development of emphysema. First of all, smoke or oxidant gas irritate the bronchi and bronchioles, which leads to chronic infection, and then it increases the mucus secretion from the respiratory epithelial cells, which causes obstruction of air passage, and the cilia of the respiratory epithelial cells are partially paralyzed and the movement is very much reduced. Because of this, the mucus cannot be removed from the respiratory passage, and then the destruction of alveolar mucous membrane occurs. Then the destruction of elastic tissue occurs. Normally there is loss of some elastic tissue because of the proteolytic enzyme called elastase, but that is very much negligible. Moreover, the liver produces elastase inhibitor, especially alpha-1 antitrypsin, which prevents the destruction of elastic tissue. But when a heavy smoker person or a person who is exposed to oxidant gases, the pulmonary alveolar macrophages increase in number numerously. Then macrophage releases a chemical substances which attracts a large number of leukocytes, and leukocytes release the enzyme protease including elastase, which destroyed elastic tissues of the lungs. So when a case of smoker or oxygen gas is exposed person, it is a problem for emphysema. Now, what are the effects of emphysema? Airway resistance increases several times due to the bronchial obstruction. So, the movement of the air through the respiratory passages becomes very difficult and it is more pronounced during expiration. Number two is due to the destruction of alveolar membrane and elastic tissues, the lung becomes loose and floppy. So, the diffusing capacity reduces to a greater extent. And however, the lung compliance increases and the aeration of the blood is impaired. Enough oxygen cannot diffuse into blood and carbon dioxide cannot diffuse out. Then we have discussed the obstruction also affects the ventilation perfusion ratio, which results in poor aeration of blood. Then discussed that due to the destruction of lung tissues, the number of pulmonary capillaries also decreases and it increases the pulmonary vascular resistance, which leads to pulmonary hypertension. And over the years, chronic emphysema would lead to hypoxia and hypercapnia. It will finally cause a prolonged and severe air hunger, that is dyspnea, and which leads to death. So today we have completed the respiratory disorders. If you have any query or any doubt about any disorders of respiration, you can comment down in the comment section and I will try to resolve your problem. And if you have any question, you can also ask in the comment section and also suggest me a topic you want in the next video. And thank you so much for watching the entire video. Do like, share and subscribe to my channel for supporting me and my channel, and thank you so much for watching.